Now, John Peplow was telling me that he was the person who led you to start your world first work, your world leading work into Parkinson's.
Where's John? Yep. So John was referred to me just a few weeks after the first neurologist, the non-tissue giving neurologist.
Yeah.
And John, instead of sitting at home with his pills and waiting for 10 years, went out and was proactive and he wanted to find something else to do. So he was referred to me at Metro Rehab Hospital. And meeting John at that time, my experience in Parkinson's was more with patients with more advanced Parkinson's. So generally, the more advanced patients were the ones that ended up in rehab because of broken bones or other sort of, secondary complications. So having someone who was young, working, only weeks from diagnosis.
You could have thrown in good looking.
Good looking, yeah. Yeah. A younger John was, something I wasn't expecting.
Yeah. So. Were you aware then of early onset, how common early onset Parkinson's was?
At that time, no. I mean, that was in fact. I remember coming out going, "Ooh, I've just seen someone who's young and just weeks from diagnosis." But as we went through the consultation, and I think those of us who treat Parkinson's, even though he was early in diagnosis, John had already had both motor and non-motor symptoms that was affecting his function and activity, and he was overwhelmed.
Yeah. Now, knowing what you know now, how important do you think it is, when someone's diagnosed, to sort of push the tissues away and do something, and what would you suggest that they do?
Yep. So I think the suggestion is, and leading from that, I think what every patient that's been diagnosed with Parkinson's deserves to be linked into a multidisciplinary rehab program which incorporates exercise programs like the PD Warrior, but also, involves sort of... do I get another chance to chat? Or yeah.
You're doing well. Yeah, you're doing well. Well, should we have another chance to chat? Yes, they love you. They're going nuts.
Yeah. No, because it's about linking in rehab early so that patients like John, what we discovered was after he attended a program at Metro Rehab, which was multidisciplinary, he got the tools and the education and support to just help him start off that journey, or the unexpected journey of life with Parkinson's.
Yeah. Now, we will come back to you. We'll give you all 2 chances. Melissa?
Yes.
There's been a bit of talk here about PD Warrior. Do you want to explain how it works and what benefits it gives?
I'd love to. I'm awfully impressed. So PD Warrior is a program that is based on exercise, but I think, as you're saying, Anuka, exercise is the vehicle to help people develop that self-esteem, that self-efficacy that's so important in, I think, challenging the perspective that people have about having their Parkinson's and how they live with their Parkinson's. And I often say, when I have a patient come into the clinic, within a week or 2 of diagnosis, it's possibly that sliding doors moment, because I think if they don't come in at that point in time, it may well change the trajectory of how they live their life and how much positivity they have around it. And I see a lot of people that don't reach out for various reasons, and they become quite socially isolated quite quickly. They start to give up work and social interactions and a lot of those things that I think are unnecessary given the right tools and strategies that you're talking about. So I think rehab is essential, not so much for the exercise, because that's almost a given. It's about building that confidence and getting those quick wins in early, that you don't have a glass ceiling. You can still achieve an awful lot. It's just developing the strategies and the methods and the ways to do that, and believing in yourself that it's possible. And I've certainly seen that in my clinic. I've seen what you guys have achieved. 5-10 years ago, we wouldn't have thought it was possible to have such a good life with Parkinson's. It's possibly the most exciting time now that I'm seeing in the literature, and from what my patients are experiencing. There's just so much information now. We know we have so much more to offer. So I think it's a very exciting time at the moment.
Yeah. Now, Dom, it's very hard. Every time I've met Dom in the past, we've gone through a little bit of a Parkinson's dance, because I enrolled in the PPMI program, which is Parkinson's something markers initiative. Progression. And so I'd go in every 3-6 months and have MRIs and we were talking about diagnosis. I did have a definitive test.
Yeah, so the PPMI, which is sponsored by Shake It Up Foundation and through Michael J. Fox, is a study that's been going since 2012, and it's trying to understand what are the factors that are involved in how Parkinson's disease gets worse. And so this was a very ambitious project headed by a chap called Ken Marek, who is the nicest man who's ever drawn breath. How he actually cajoles a room full of neurologists, which are sort of like cats, into doing what he asks them to do is really quite remarkable to watch. And the commitment of the people who have volunteered to be part of the study, so it's 400 people with Parkinson's disease, 200 normal controls, and we have 80 people who have sort of little bits of Parkinson's disease that we call SWEDs. And
me.
And you, yeah. And you know, the commitment for people to turn up and have lumbar punctures and MRI scans and special scans to look at dopamine in their brain is really quite remarkable. And it's an astounding project and really one of a kind. It will never happen again.
Yeah, but my wife turns up to watch all the procedures because she's quite the ghoul. she loves it.
The PPMI is like being a wheel on a semi-trailer. So if you don't actually keep up to speed, you get in trouble. So it's quite an extraordinary study that will enlighten us about what are the factors that are involved in the different forms of Parkinson's disease and how that gets worse.
Yep. What's it like? I know what it's like to be told. What's it like to tell someone they have Parkinson's?
A lot of patients come to me for a second opinion, but sometimes that's not the case. And telling someone that they have Parkinson's disease, I never do that by themselves. And so coming to the diagnosis, the clinical diagnosis of Parkinson's disease, you listen to the story, you examine the patient very carefully and thoroughly, you look for other conditions that may mimic Parkinson's disease, and then you will say, I think that we might be dealing with Parkinson's disease. And 99 times out of 100, the person who comes to see you already, they go, I thought I had that.
Yeah.
So, but it's still an inflection point when someone says to you, I think you have Parkinson's disease. And the impact on the person who you're telling is profound. And so I always take a lot of time, and there's a lot of space and silence, and there's always someone else there. Their partner is in the room.
Yep, cool. Now, the first thing, it wasn't you who diagnosed me, I saw you later, but the first thing I asked my neurologist when she said come back the next day with any questions, I asked, could I have a disabled parking sticker? And you still haven't given me one, so why can't I have one?
You're not getting one.
You've got one.
No, I don't.
I saw you get out. I saw you park your car.
No, I park in the disabled spot. I don't have a sticker. Come on, I'm a doctor. Okay. I can do anything.
Fair enough.
No, but he still asked me for a disabled parking sticker, and, you know, it's 50 metres from the front door to my room, and you can walk that easily, so you don't get one, lad.
I walk faster when I leave.
Yeah, that's true.
I even had to get my hip replaced to try and get a sticker, and it didn't work.
No.
You wanted to talk again?
Yep.
Remember?
I did want to talk.
Yeah, okay.
Yeah. I just wanted to say, so overcoming the challenges of this complex disease requires a team effort, and I don't do it alone. And I just wanted to shout out to my team that are here from Metro Rehab and Royal Rehab Private, because it's not just about the exercise, whereas I think the PD Warrior component is an excellent part of our rehab program. I'm excited that Royal Rehab is going to have one soon. But it's about the occupational therapists, and we've got Susan here, and I've got Amy here, and they run sort of LS Sweetie Loud. We've got nurses, we've got speech therapists out here, we've got physiotherapists, exercise physiologists, clinical psychologists, and social workers. So it's about having the team behind you. And I think a forum like this is important for the collaboration between the patients, carers, and the healthcare providers so that we can be getting these services out to patients early in the disease.
Okay, I have a question for the three of you to answer one at a time. Mel, you can go first. I would like to know, what shouldn't someone Google when they get diagnosed with Parkinson's, and what should they Google when they get diagnosed with Parkinson's? Because everybody does.
That's a really good question. I would probably recommend that people don't Google Parkinson's at all, because I think the capacity to catastrophise and struggle to interpret the information for the independent person is probably challenging. What I do think they should Google are support services, Parkinson's New South Wales, for instance. It's not funny, things that will uplift them in their journey.
Okay. Dom?
Well, I think people inevitably do Google, and as a doc, you've got to be aware of what people are reading, and there's a lot of shit in the internet, and I don't know
You're not
about you,
referring
Simon.
to itsnotfunny.com.au, are you?
Well, that comes up as number one, but everyone with Parkinson's disease wants something that's going to change the course of their disease. That's what they want. They want the disease to stop, and they want symptomatic therapy so that they are close enough to normal as possible. So, and you see proliferation on the internet of near-infrared light or cannabis oil. I mean, I think I should become a broker for cannabis oil, the number of people who want it in the...
I used to be. Mum.
Oh, okay.
Shh, don't tell my mum.
So I think as a health provider, healthcare provider, people are fully au fait with what's on Google. And if you don't know what's on Google, it's people will come and ask you. And, I always say to the people that I look after with Parkinson's disease that the only silly question is the one that you don't ask. So even though I've answered, just like Simon and like Paul, about near-infrared light helmets about 100 times in the last 6 months, we need to deal from strength and what we know, and partner with the people that we look after to conduct good research to understand Parkinson's disease, to produce therapies that change it and hopefully stop it.